Number two, the resolution also urges member states to increase awareness on sepsis. National surveys consistently report low community awareness on sepsis, its signs and symptoms, its causes, and its toll on death and disability. Therefore, the resolution calls for healthcare workers to increase awareness of sepsis by using the term sepsis in communication with patients. So that's the garbage code that I was talking about in the previous session. The end cause, we ignore it. So we never mention sepsis, yet it is actually the end cause of the death. So ensuring greater awareness on the part of both the public and healthcare workers is a crucial step in reducing the global burden of sepsis, and approximately 70% of sepsis cases are community acquired. So we need to use this word, people need to understand it, and the more we mention it, the more awareness and the more attention it is given. We'll be doing at SCA. This is one of our meetings where Professor Kanesugula Robert of the material. Again, awareness programs should also teach healthcare workers both to recognize sepsis and to understand it as a true time critical medical emergency. Reports and individual patient stories consistently identify delayed treatment as a major cause of preventable death and disability, encouraging patients, relatives, and healthcare workers to ask, could this be sepsis? Saves lives. So the moment we bring it in the spotlight, we could be able to save lives. And again, on the resolution on awareness, this calls, urges member states like Uganda to engage further in advocacy efforts to raise awareness of sepsis, in particular through supporting existing activities held every year on the 13th of September. The other clause in this resolution is adopting clear treatment guidelines and performance targets. Clear treatment guidelines and performance targets tailored to local environments and available resources are also essential. Effective examples of this approach that have reduced mortality can serve as templates to be adapted for local conditions and use. We know that our contexts are different, so what the World Health Assembly is saying is that let's get, maybe there is a bench we can benchmark, but consider our contexts. Still underpins why this engagement is important. Then the other is to bolster public health initiatives to prevent sepsis. Member states are urged to bolster public health initiatives to prevent sepsis. Surveillance systems for detecting outbreaks early regarding infection and provision of simple early treatment can help to counterbalance the effect of the lack of critical care facilities in many LMICs, low and medium income countries like Uganda. This resolution also recognizes the perceived conflict between rapid administration of antibiotics to treat sepsis and efforts to combat antimicrobial resistance. That's why the Assembly is also speaking to this. The efforts to reduce the burden of sepsis must go hand in hand with measures to minimize antimicrobial resistance and be consistent with the WHO approved Global Action Plan on antimicrobial resistance. Escalation based on identification of the causative organisms. So, regardless of the fact, still antibiotics are very necessary for the treatment of sepsis. Information technology is refused. It highlights a world free of sepsis, requires the recognition of the key role of prevention. Prevention, like our executive director already highlighted, of infection and resultant sepsis through vaccination, access to clean water, sanitation and hygiene in homes, schools, and healthcare facilities. We know how our hospitals are. We find sometimes medical waste on the floor. Someone just steps on it and gets an infection from there. And so this is very, very important. And hand hygiene in healthcare facilities. We also have the World Health Organization's initiative on proper hand washing. So there are some of these are already the focus of national programs. However, the resolution on sepsis supports and enforces these programs. Then promote research aimed at innovative means of diagnosing and treating sepsis. This I already mentioned also that some of our partners are doing this, and we need the support of Parliament, policymakers to be able to have more research for new antimicrobial and alternative medicines, rapid diagnostic tests to ensure early detection, and then vaccines and other important technologies, interventions, and therapies. So this is, I don't have to go through this. This is within your folder. Has the potential to save millions of lives. To realize this potential, the actions proposed in the resolution need to be taken. These actions require coordinated efforts by politicians, policymakers, healthcare administrators, researchers, clinicians working with people of all ages in all healthcare settings and in the community. The community is very important, and us as the Uganda National Health Consumers Organization, it's where our focus is. Our partners are working, scientists are working on research, are working on other areas that are highly technical in that area. For us, we're also working on our technical side, which is the community. Yeah, which is really sometimes less seen as less technical, but really managing, informing and sensitizing communities is our area, and that is where we are focusing. Actions will vary by region and country and must acknowledge the unique challenges faced by LMICs like Uganda. I thank you for giving me the opportunity to present this to you.
Some perspectives in Uganda. One of them is that the prevention is not given its due concern in Uganda. That's why we are waiting for sepsis at the healthcare system in the clinics. And the clinics cannot even detect. Most of them, where I've moved to Kawale, Kanungu, Windi, and the Yumbe, then the Chidera Health Center, then the Uvuma Health Center, they can't guess what sepsis can be. So the issue of prevention, in addition to the resolutions of the World Health Assembly, must be taken care of. Then also, recently, most of the Ugandan clinics will tell you, you have an infection. You are suffering from an infection. Which infection is that one? So it would be better to clarify that it's a bacterial infection. But be it younger ones, be it the elderly, they say he has an infection. So until the person dies, they've not even talked about whether it's sepsis or not sepsis. Then the clinical guidelines in Uganda that we have emphasize maternal sepsis, not the sepsis we are talking about. So there is need for guidelines in Uganda that are context specific to develop what can serve all of us. And lastly, I want to re-emphasize what is discussed in this paper. Sepsis is kept in the background. So it's time for action that people can now understand. We do sensitization and also take it away from the clinics to the communities. And it's the reason as to why we are here. But we also request and ask the policymakers to assist that we have guidelines at national level, but also incorporate it into the health management information system, that it's captured, we can monitor and ensure that we are making progress towards the World Health Organization resolution at the Assembly. I submit, Chair.
Chair, yes. Thank you. I would like to add something small. Basically, the work that we are currently doing, we are currently carrying out community awareness in different communities, but you find their understanding and the interpretation of sepsis is very different. And in most cases, when they go to the facility, they say somebody has died of infection, but they really don't understand what is that infection. And then we are also doing capacity building for health workers this is ongoing. And then we have done engagement with the KCCA, the different division, trying to mobilize them and share this information with them. We have also done capacity building for media, but this will continue. This is to help them really share this information with the public out there. So we also, part of our engagement, of course, with you, the policy and decision makers. Thank you very much. Chair, over to you.
This is your time. Honorable.
The common diagnosis of infection, I found it to be a useless and redundant diagnosis most of the time. So please, I urge you not to take it seriously, because I practiced and taught medicine for some time, and I was teaching in that area, so I found it that. Let me give you just one example. There is a lady who also works here, which is called Allen. I met her one morning in the canteen, and Allen had been diagnosed with malaria and infection. Malaria and infection. For her, she was convinced that she had malaria, because infection was, I think, more funky. It has had sounds, I think, more serious than malaria. She had the +2, and for us now, if you have +2, you cannot swallow tablets and recover. You must get injections in one way or another. That's now obtaining severe malaria. So she was actually having a severe headache, and I said, "What's the doctor?" She was saying, "Doctor, I have gone to these people, they are treating infection, but it's not going." I said, "Show me your results." They said, "You see, I have malaria and infection." I said, "You don't have infection, you actually have malaria." Because there are a few instances when you have infection, you cannot get. Sometimes it is there, but there are a few instances where when you have an infection and you don't have a focus. An infection, most of the time, in 90% of the time, it has a focus. You just get an infection. Oh, I'm walking with you from where? Very short. I told her that what is causing your problem is poorly treated malaria. It's not infection. And I said, they take my number and give it to the doctor who is there, and I want to talk to him and tell him to stop joking around with your life. Yes, because then Allen said, "You see, doctor, me, I know I have infection." He said, "Okay, you either go and you either continue and die, or you go and treat malaria." Anyway, she went back, and when she was tested, actually this time, malaria parasites were +3. And she survived just because I just met her in the canteen by mistake. I had not even made an appointment with her. So she went and she was treated for malaria. And I said, "Let me talk to that doctor." And I told the doctor, "Doctor, this patient does not have infection. The infection you are thinking about, the patient has malaria. Please treat malaria, and the patient will be fine," which is fine, and she's here. Another thing I want to make clear is that the sepsis is not only about bacteria, and it is very clear here. You can get sepsis from viruses, from malaria, as long as you have TB, as long as that, okay, it's called, let's say, that infection, either from malaria or TB or virus, causes a dysregulation or confusion in the body system, causing low blood pressure, whatever you have said there. That is now what is called sepsis. So, in my view, it is something that is not, if infection is not well understood, and sepsis is actually much more complicated, even for us physicians to explain it, even in the words it is taught in English. It is not as easy to diagnose, and it is not as easy to understand, and it is not as easy to treat. So that is the conundrum of how you are going to attack it. So, in my view, the first thing you do at community level, I think we should avoid the word sepsis. It is just going to confuse people for no good reason. I think at community level, let us go for vaccination, wash, that is the water, sanitation, and hygiene. That's at community level. We did that. Then, of course, also we do sensitization about those things. Then
It makes it very complicated now
you
to manage.
You can call it a reaction. You can
Could
call
be
it
reaction, a symptom of some viral infection or bacterial infection, and now you call it
good
sepsis.
student.
It is really confusing. I don't know how you're going to package it because the expert advised the word sepsis makes it more complicated for a layman to understand, including myself. Now, you the expert, you know, because for a doctor now you can assess it. You have malaria? No, you don't have an infection. Because many doctors have been telling us, and it is everywhere. You have typhoid and infection, and everyone, what is infection? You have malaria and infection. So we don't understand. And when you say that any antibiotic can be used to manage sepsis, I was like, man, because there are so many antibiotics on the market. But we have to be very specific. Which antibiotic is difficult to treat is sepsis?
Mr. Chairman, I am one person, of course, getting closer to medical practitioners and physicians. I'm one person who always complains. Our wives or mothers of our children, they are the biggest number that appear with our children to physicians for treatment and management. The health worker prescribed writes on a medical form, malaria, typhoid, and infections. And somebody said it's not very common that somebody with malaria will have typhoid at the same time. But the way health workers or practitioners, especially with these smaller health units, want to survive are confusing and distorting everything to do with the treatment. Now to do with sepsis, sepsis okutana. Chiri gwajo tekikutunuza ngalira okutana chechi. Yes, chendozo okutana. I used to hear, when people get injured, say when they are digging or when they say, give him treatment for tetanus, and such that they don't contract tetanus. And then I always have but now I'm trying now to do what sepsis now. So our communities, I know, they know this, but probably the treatment, to some who do not get probably refresher courses on health changes that change day and night after. I would recommend that also our health workers in the countryside get enough and repeated health reviews and refresher courses on new developments of infections and diseases.
We can, one of our messages, can be that if you have an infection, not the other silly infection, but the real one, like malaria, like viral infection, like diarrhea, like cough, which is, in simple terms, it can easily become worse into sepsis. That's would be a good message to give the people. It can easily become worse and turn into sepsis. If you have TB, if you have malaria, then you continue to in that way.
Much, Doctor, for such professionalism. Doctor, I suffered with this explanation to people when you're talking about. People think that all infections mean bacterial infections, and they give antibiotics. But viral infections are infections, malaria is an infection, everything. So I wish if that message which is that not all infections are treated by antibiotics.
True.
Then in 2, you talked about research on antimicrobials. There is a tendency in our medical practitioners that when you talk of antimicrobials, you're talking about antibiotics.
True.
All antibiotics are antimicrobials, but not all antimicrobials are antibiotics. I think that should sink into our medical practitioners. They think that all antimicrobials are antibiotics. No. So that's why they end up giving wrong prescriptions. After getting a good identification, after doing a very good diagnosis, they end up giving a wrong prescription. I think that is the major cause of sepsis, wrong prescriptions. Of course, if you give a prescription, the body will react. Maybe lastly, sepsis has lacked a proper description which can be understood by the public. The way you are explaining it, you are explaining it as if it is a primary infection. You need to take me a day to explain that to me. This information you have given, that 76% of sepsis cases are communally acquired. How can you explain to me that which you are giving me? How can you acquire sepsis communally? How? Because sepsis is just a response to this harmful microorganism within the blood. As the body responds to that harmful microorganism, that's what causes sepsis. And then you are telling me that 70% of the sepsis caused cases are communally acquired. It means you. That's why we also talked about it. We need refresher courses. I think medical used to do it. And if you spend more than 2 years, 3 years, you need to come get a refresher course.
It does not have. We cannot do that. Just speak any language. Sepsis is sepsis. What is English? Whether it's Uganda or chicken, you call it sepsis. Anyway, I will listen to the presentation and discussions, but we have failed to understand, to translate that term to our language. And you know, when you are doing public health, the people you are talking to are people, some people have never been to school, they don't have a medical background. So, going to the community talking about sepsis, you may end up confusing them, according to me. You may end up confusing them. And we have heard my colleagues talking about the health workers making diagnosis. But do they have the skill? Are they properly trained? Do they have the equipment? Because they go to our facilities, you find a microscope and maybe a lab person and of course a technician. So for the microscope, what you can see is maybe malaria parasite. But you don't see any other, because they can't go beyond that. So it means we need to equip our facilities. We must have skilled health workers. Otherwise, sometimes those diseases are treated by guesswork. And at the end of the day, you end up using a lot of drugs. But also, even the drugs on the market. We have too many drugs on the market. But where do they come from? And how are they kept anyway? Stored, they end up getting resistance. I think the most important message you have to pass on to the community, I think Honorable Kamara hinted on it, is prevention. When you fall sick, go early and get treatment. Hygiene and sanitation. Good nutrition. Exercise. Avoid junk foods. We end up getting diabetes. I don't know if you mentioned about something like that. I think that's the message.
You have to pass to the what? To the community. Because once if somebody gets treatment early enough, when the drugs are there and also a well-trained medical worker with equipment, you're talking about the antibiotics, you know, we can't do culture sensitivity in our facilities, you know, where you can say this infection can be treated by such an antibiotic. And equipping our facilities and telling our communities to seek medical attention early enough, and those are going to have that I've mentioned, then you can prevent sepsis. It is something which is even medical workers, I mean, which is, I don't know, we cannot even understand it clearly. You get it? That's why this malaria has malaria and even sepsis. Antibiotic. So, but the message you are passing to the community was extra careful. For me and Dr. Kamara, and maybe Dr. Karusu and Dr. we can understand here. And please, you know, you're going to politics. You don't want to campaign talk about sepsis. You know, you might cause confusion. But look for how we package the message. The message, but it's very clear. Simple things. Prevent falling sick. Avoid falling sick.
We are discussing are the things you know and have gone through. Maybe just to say that this conversation on how to translate sepsis, what sepsis is in our different languages, we have discussed it here and at international level, and even professionals have not been able to give us a translation into their languages. So what we do is look at symptoms. You may have seen one of our slides at the beginning that specifically talks about symptoms. That's the message we give to the community. If you see this, if you don't feel well, if you have fever, you need to quickly run for professional care and get early treatment. But also the hygiene is what we principally emphasize. The clean wash of hands, the dealing with food, all of that is the message that we give when we talk about, because the definition in the translation has been discussed broadly, and even health professionals have not been able to give a definition, a word in their own languages. So that debate continues. Of course, the other thing that we want you to speak to is getting Ministry of Health to look at guidelines specific for sepsis. So that, and that is one of the challenges for service providers, that the guidelines for broad sepsis beyond maternal health is a gap that really needs to be addressed. The other area that you have emphasized is when I listen to your stories, it is also the level of understanding of health professionals. That will be the solution, that health professionals know how to diagnose sepsis, but also that they are sincere, especially those in the private sector, that they are not hunting for money, that they are giving us the right treatment. Of course, the other big challenge is going to be equipment, which remains. Most of those people you see that giving you a wrong diagnosis, they get it from the level, the equipment, the quality of the equipment that they have.
The other thing is that this discussion has to start somewhere. Because as we had started at the beginning, the World Health Assembly sat and said, talk to the community. So it's a very, very complex discussion, but I think as we talk, we shall find solutions. If we don't start, then we shall never find a solution for it. Yet it contributes heavily on the morbidity and mortality. So I think for me that's the most important thing, that we start somewhere, and with your advice that you have given us, we work on the messaging so that the communities are understanding, but we have to start. I think for me, that's what I understand from the advice you've given us. Thank you so much.
When we're explaining the symptoms and prevention, you hear somebody say, I've had my cough for the last 10 months. And they have been accusing each other. You're accusing your neighbor of having put something for you in your water, and that's why your cough is not going. But you forget that, this could be maybe some infection or sepsis. Instead of you accusing your in-law, your neighbor, of having put for you something that is really affecting your health for a long period of time. So there's also need for us to work on the myth and these accusations that communities have there. Thank you.
That we understand things better at health centers. That's why there is a struggle constructing hospitals without equipment. But the key thing would be prevention. So now what we seek from you is that interaction with the ministry in terms of messaging, but in terms of also capturing the information about sepsis, because it's not there. So we need it to program effectively. So at your side, we could request that interaction and to ensure that the guidelines are there, but also it's reflected in the health management information system to support proper planning for this country and its citizens. Thank you.
We as legislators, one of our key roles is to legislate and to appropriate. When you come to us at our level, now that we are telling us, can you give more money? Not only to the health sector, but into other sectors. Because we talked about if you have proper hygiene and sanitation, you can prevent sepsis. If the community has very good income, you can prevent sepsis. So all sectors. So what you're trying to tell us that can the government give more money to all sectors? But of course, for example, for us, we are secured to health, because they're looking at the end. If we want water. You see all these members of parliament you see here, all of them want piped water, clean and safe water in their constituencies. Isn't it? All they want health centers which are well equipped and having enough human resource. All of them are advocating to have community extension workers in all their constituencies. But all those things need funding. So we as legislators, we know if we can be able to appropriate enough funds to all those sectors, we can be able to prevent sepsis. But as of now, we have the problem. So we are looking mainly at, of course, preventive and also how to treat. We shall play our role as legislators to appropriate enough funds, if they are available, to the different areas so that we can be able to address sepsis and, of course, and other disease conditions. With those remarks, I'd like to thank you once again and close this meeting officially. Thank you.